Good evening, Professor Wissel. We are sitting here in your medical practice, but as the title professor states, you are also an academic and you are a dean at a so-called pre-med school, the Berlin Medical Academy. How does that play an important role for your students?
I think that's a very good question. Yes, I'm a neurologist, I'm a physician, and I'm head of department, and I have an outpatient clinic, and I'm taking care of my patients. So this is giving me the background to be able to teach young students or pre-med students the right way of how they approach the very difficult basic knowledge like physics, chemics and biology, and how that fits to my clinical everyday work. And so there is a connection, and to know about that connection, that gives motivation. And I think that's the most important fact to enter a university, to show motivation to learn and then to jump over the line.
So what does pre then mean?
Pre does mean that there are a faculty available that knows about what is necessary to enter a university and to make it a little easier to start at university. So our faculty is well prepared, is motivated to bring that knowledge to our pre-medical students. So it's a connection of what they already heard and that what they should repeat to be prepared for the examen to enter university, but it's also connected to everyday clinical work.
That's true, your students must be motivated because from what I'm hearing, their success rates in entering university is pretty high. How do you explain that?
I would explain that a little bit like I said before. So we know what we are doing, and we have a real inner motivation to connect what medicine will bring in the future to those who learn our basic knowledge about physics, biology, chemics. Of course, it's very difficult to learn, but we are not stopping with this. So we add anatomy and we add our everyday knowledge, and so they hopefully get the motivation to learn all that stuff, to jump over the hurdle to enter the university. So I think that's the reason why our success rate is so high. And I tell you a secret. The secret is we know what they have to know to get the exam done.
All right. And what would you recommend to a young person wanting to become a practitioner?
I would recommend, if this is really what the person wants, then should think about not giving up if the examen level of the school is maybe not giving the direct entry to the university. So if you really want it, then you have to do something for it and do it on the pre-medical school, because we know what is the important thing. You can learn so many things, but for entering a medical faculty you have to know specific things, and we are happy to teach.
Okay, I thank you very much.